Hello, this is Dr. Grande. Today's question is, what is obsessive-compulsive personality disorder? I'm going to refer to this disorder as OCPD. Now, in the Diagnostic and Statistical Manual, the DSM, this is a cluster C personality disorder. That's the anxious, fearful cluster. And the other two personality disorders in cluster C are avoidant personality disorder and dependent personality disorder. OCPD is often confused with obsessive-compulsive disorder, OCD. Now, there is high comorbidity between these two disorders. So if somebody has obsessive-compulsive disorder, there's a 25% chance they would also qualify for a diagnosis of obsessive-compulsive personality disorder. However, they are distinct mental health disorders, and there's a number of key differences to differentiate them. For me, probably the one that stands out the most is that OCPD doesn't have obsessions or compulsions. We also see a lack of insight with OCPD more often than we do with OCD, and perfectionism is a key characteristic we see in OCPD. We don't always see that in OCD. So I'm going to go over the symptom criteria we see in the DSM, and then some of the other features that we tend to see with this disorder. So looking at the symptom criteria in the DSM, here are symptoms that we oftentimes see with OCPD. The first is a preoccupation with details, order, schedules, and lists. The second is the perfectionism interferes with task completion. We also see an excessive devotion to productivity. We see over-conscientiousness, so somebody's inflexible when it comes to ethics, morality, and values, and this isn't accounted for by cultural differences. We see a difficulty in discarding objects that are worthless or are at the end of their useful life, mostly because there's a fear that they could be useful in the future. We see a reluctance to delegate tasks, a miserly spending style, and rigidity and stubbornness. There's not a lot of good information on the prevalence of OCPD in the general population. It's believed to be somewhere between 2 and 8%. And we also believe that it is one of the more prevalent personality disorders. It tends to affect males to females at a rate of about 2 to 1. Now, when it comes to OCPD and limitations in functioning, when we think of other personality disorders, we usually see a clear connection with the behaviors, the thoughts, the emotions with impairment. For example, in borderline personality disorder, the love-hate cycle we tend to see there, or the disregard for society's rules that we see in antisocial personality disorder. With OCPD, the maladaptive portion is a little less clear. And I think one of the reasons for that is that our society tends to value career productivity. And a lot of the characteristics associated with OCPD are actually favorably looked on by a number of employers. For example, being organized, having a tendency toward perfectionism, being meticulous, and even emotional restriction. That emotional restriction we see with OCPD is favored in a lot of work environments. Some other OCPD traits that would be seen as favorable by employers would be a decreased interest in leisure, not taking vacations or not taking them very often, usually an extreme loyalty to the company's values, and respecting authority. Individuals with OCPD are often punctual, they use grammar well, they have a formal language style, they tend to be serious, and they don't tend to take chances in relationships. So, for example, they'd be much less likely to be involved in workplace harassment. There are, of course, some downsides when it comes to some of the characteristics we see with OCPD and the workplace. Individuals with this disorder are more likely to poorly express themselves with their body language, so their body language can be misinterpreted. And those restricted emotions, which can sometimes be an asset, can also be a hindrance in terms of the social climate in a workplace. Also, individuals with OCPD are more likely to be sensitive to criticism, dislike ambiguity and uncertainty, dislike new ideas, lack creativity and imagination, and tend not to have many fantasies. Also, they tend to lack empathy. And lacking empathy in particular is usually frowned upon in social situations. Also, individuals with OCPD tend to be condescending or look down on individuals who are overly expressive with emotions. For example, somebody who's high on the extroversion trait. They would look at this as immature or irresponsible. And they also tend to dislike individuals who are impulsive, so individuals who are low on conscientiousness, for example. In terms of a home or family life, some of the characteristics that could affect that would be difficulty expressing affection, love, and tenderness. That's fairly common with OCPD, and also an inability to relax. A number of times when we see individuals with OCPD come into treatment, it's because somebody from their family has had enough of the perfectionism and the dedication to work, and they want more of a commitment to family life. Usually it's not because of some problem at work, although sometimes of course it is. Some important points when it comes to comorbidity. I mentioned there's comorbidity between OCD and OCPD. But if you look at the comorbidity with obsessive-compulsive disorder, an individual with that disorder is actually more likely to have comorbid avoidant personality disorder or dependent personality disorder than OCPD. Now, comorbidity with OCPD in terms of other personality disorders, we see high comorbidity with avoidant, borderline, histrionic, paranoid, and narcissistic personality disorders. Now, in terms of treatment, individuals with this disorder are usually reluctant to go into treatment. This is considered a common problem with OCPD. When somebody does come into treatment, some of the techniques that have been shown to be somewhat effective would be working on problem solving, like for example with cognitive behavioral therapy, time management, and trying to increase empathy. I hope you found this description of obsessive-compulsive personality disorder to be interesting. Thanks for watching.